Yeah, I think there are a lot of both challenges and opportunities of AI, and you mentioned the bias issue. That's very much there, but it's the bias in us when we are creating the AI algorithms. The AI itself is not biased inherently; it's we are creating them. So uh, the logic we are putting in can be biased when applied in other contexts. One of the use case I have been involved in recently is creating this high resolution air pollution map. So I live in Baltimore. There is regulatory data on air quality in Baltimore, but at one site within the city. So we get no idea of what's the spatial variability of air pollution within the city, which is, it's important to know that to understand which communities are being exposed to a disproportionate extent, and what are the steps we can take in terms of policy to kind of mitigate that, but there is just no data. So there has been recently a lot of progress in technology, and there is this low-cost air pollution sensor that have become very, very popular in US and in many other countries. And so there is an operating network in Baltimore that's measuring air quality at more than 40 sites. So we were thinking, oh, this is great. Now we have data instead of one site, we have data at 40 sites. So that really improves our ability to kind of infer about exposures at finer scales. But then there is really no free lunch. When we looked at the data from these low-cost monitors, they're very biased because they're cheaper devices, right? So that comes at a cost of the data not being very accurate. So that's where AI comes in. Like we can kind of evaluate those biases and correct for those biases and produce maps using the very small amounts of high quality regulatory data and data from a large number of locations from these low-cost sensors, but which are very biased and noisy. And we create statistical models that were able to kind of fuse data from these sources and create maps. So that's a nice use case of AI. But then there's also cautionary tales. So one project that I work on is evaluating these causes of death in children and neonates in Mozambique. And Mozambique, like many other countries, there is lacking high quality data on causes of death for a majority of the deaths. And what often happens is that the government or some program does like a field survey where they go out house to house and ask if someone died, and if they died, what were the symptoms manifested before death, and records those responses. And those responses are then passed through an AI software, which then gives a predicted cause of death. And that is often being used in sort of the health metrics that are published by this country. So we were planning to use the same protocol using this AI software to kind of get the cause of death from the survey data in Mozambique. And we started doing that, and we thought we should evaluate how accurate these AI software are, because these are not created using data from Mozambique. They were trained using data from 4 countries, but that did not include Mozambique. And so when we evaluated it, we saw that they were less than 50% accurate. So there is like huge biases because there are specifics to the data is being collected by workers. So there is sort of cultural differences across countries and how you ask questions and how you respond to questions. And those kind of introduces bias in the logic of these AI systems. So they were like really producing biased estimates. And so we had to kind of then use limited amount of data from hospitals where we were able to cross-tabulate what the AI was predicting and what the autopsy revealed. And we matched and understood how biased these AI algorithms were, and then kind of produced corrected estimates. But it sort of served as an example for us. Like if we just think, oh, this AI tool is a panacea for all systems, it will produce correct predictions that we can use for any science we do going forward. That's not the case. We have to be very careful in our evaluation of AI as we kind of increase our usage of